to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headline. Family adoption program finds its place in new MBBS curriculum. The National Medical Commission has finally introduced an altogether new family adoption program in its new competency-based medical education for undergraduate course curriculum. Although the speculations of this new program had been at place for a long time, the confirmation regarding this came only after an MC published the CBME curriculum for MBBS course. The new curriculum has provided details regarding the need of the program, aim, objectives, specifies of the program targets that the students need to achieve. An MC mentions in the circular, family adoption program is recommended as part of curriculum of community medicine and should begin from first professional year and remain throughout the curriculum. The orientation towards the same may be a part of foundation course under the theme of field visit to community health center, which is already allocated to foundation course in GMER 2019. The family adoption shall include villages not covered under PHC adopted by medical college, and if travel time from college to site is more than 2 hours on weekends, in such situations, towns or an outskirts of cities may be adopted. COVID positive rate soars to 7.72% in Delhi, testing still low. The positivity rate of COVID-19 shoot up to 7.72% on Monday, with testing dropping sharply over the weekend. Only 6,492 tests were conducted on Sunday, down from Saturday's 12,000. Despite this, the city recorded 501 cases. With this, active cases have reached 1729, an increase of nearly 269% over the last fortnight. The occupancy of COVID beds has also gone up. Dr. Bishnu Panigrahi, Group Head of Medical Strategy and Operations at Fortis Healthcare, said people suffering from obesity, hypertension, diabetes and other comorbid conditions were at higher risk, but overall the current wave of COVID-19 does not seem to be causing severe illness in people. One of the reasons behind this is vaccination. Exemption to SII pneumococcal vaccine from price control for 5 years. In a major relief to Serum Institute of India, the drug price regulator, the National Pharmaceutical Pricing Authority, has decided to grant exemption to Serum Institute of India's indigenously developed pneumococcal polysaccharide conjugate vaccine against pneumonia from price fixation for a period of 5 years from the date of its commencement of its commercial production in the country, subject to it being coterminous with the duration of the Indian patent. Following the company's submission, the exemption was granted for Serum Institute of India's formulation of pneumococcal polysaccharide conjugate vaccine, IP in single dose 0.5 ml vial, multi-dosage 2.5 ml vial and pre-filled syringes of 0.5 ml single dose. This came in line with the application filed by Vaccine Major Serum Institute of India for exemption under Para 32 of DPCO 2013 for the formulation of pneumococcal vaccine IP. Prime Minister Narendra Modi to lay foundation stone of WHO Centre for Traditional Medicine in Gujarat today. On the second day of Prime Minister Narendra Modi's Gujarat visit, two important events are on the agenda. This includes the inauguration of the newly made Banas Dairy Complex in Diodar in Banaskantha district and the laying of the foundation stone for the WHO Global Centre for Traditional Medicine in Jamnagar. The WHO's Director General Tedros Ghebreyesus and Mauritius PM Pravin Jugnauth will also be present for the ceremony. The centre will focus on 4 main strategic areas: evidence and learning, data analytics and sustainability and equity, and innovation and technology to optimize the contribution of traditional medicine to global health. 35 acres of land have been provided for the centre by the Gujarat government for free. The construction will be completed in 2024. However, the functioning of the centre will start at a makeshift place this month itself. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.